What's up, y'all? Good morning. It's about 7:35, January 2nd, 2025. I'm having my gastric sleeve surgery today. I'm excited. I'm nervous, but I'm ready for a new year, 2025. I just wanted to get on here. I'm smiling so much because I'm so happy. I finally made it. I finally did it. I'm at the date. I just wanted to get on here and just let y'all know that I'm on my way to the hospital right now. I'm definitely gonna do some vlogs in the hospital. I'm gonna definitely try to vlog directly after surgery if I'm not in too much pain. Um, but yes, I'm excited. Let's get it. Let's go. Make sure y'all like, comment, subscribe, ask questions. Anything you want to know about the surgery. Um, Till next time, let's get it. Okay, y'all, I'm at the hospital. It's go time. They got me taking off my nose rings. Jewelry, you can't have no jewelry. I gotta take this one off too, but I'm waiting until the last minute because I only got this in August, so it's December. That was like 3 months ago. I hope it don't close. But yeah, we lit, y'all. It's going down. It's really going down. I'm just waiting for them to call me in the back now. Yeah. I'm gonna definitely keep y'all updated. So yeah. Boom, boom, boom. I'm in the waiting area. I got my mom over here. Lit. I'll be back, y'all. Make sure y'all like, comment, subscribe. What's up, y'all? I'm back. They got me in the area. I'm nervous right now. I gotta change, put my stuff in there. They getting me ready. But I'm just keeping y'all updated. Let's get it, let's go. I'll be back, y'all. I'm nervous right now. I'm excited, but I'm nervous. But let me get changed, and I'll see y'all after surgery. What's up, y'all? I'm about to get my I'm getting prepped so I can have the surgery. I'm excited. What's up, y'all? I want to thank everyone who gave me well wishes. I'm feeling okay. The surgery was a success. I I know I look a mess, but I just wanted to come on here and thank everyone. Make sure y'all subscribe to my YouTube channel, Finding My Destiny. I'm going to be dropping videos about the surgery. If y'all have any questions, make sure y'all subscribe and leave a comment in the comment section. I'm drowsy right now. My pain finally going down. Thank God for that. But yeah, thank y'all again. Shout out to all my real ones. All my real ones. My day ones. My bestie. Shout out to everybody who showed me love and well wishes. I'll keep y'all updated. Love y'all. What's up, y'all? I see everybody asking me what kind of surgery did I have. I had weight loss surgery, which is a gastric sleeve. That surgery is where they go inside your body and they cut your stomach into the shape of a banana. And they take the rest out. So the shape of the banana stays in. The rest of the stomach comes out. It's not plastic surgery. It's weight loss surgery. It's a big difference. I just wanted to come on here and tell you that because I see everybody asking me what kind of surgery they think I did plastic surgery. It's not plastic surgery, guys. It's weight loss surgery. And I would like for y'all to subscribe to my YouTube channel because I'm going to be dropping all the details. And you can ask me questions over there. So you could get more information. I appreciate everybody reaching out to me, asking me those questions. And I appreciate everybody that been showing me love on my weight loss journey. It's been a long time for me coming. It's been years that I considered doing this surgery, but I want to say about 5 years ago, I tried, but I backed out. But over this, I want to say from in 2025, 2024, I noticed that my body was acting weird. And I noticed I gained a lot of weight. The heaviest I ever been was 418. And I couldn't do certain things that I normally do. And I knew that I needed to make a change and that I was going down a dark path. So I decided to take the weight loss shots first and work on getting my surgery, my weight loss surgery, during me taking the shots. I know people on the internet, they hear a lot of things, but I'm the person that could tell you about everything because I've been on every last shot. I've been on Trulicity, I've been on Ozempic and Mounjaro. See ya.
All right, we're gonna go through some post-op expectations and instructions. We're going to, I'm gonna go through a few questions with you first, just to see how things are going and see what I need to really focus on during our conversation. Okay. So today's post-op day 1, after surgery. The majority of your pain right now is going to be caused from artificial gas that they insufflated into your belly yesterday to do the procedure, okay? Yeah. This gas lingers in your abdominal cavity and your body has to start absorbing that gas into its intestines so that it can come out with flatulence. Right. So that's one of the reasons why we tell patients, you're not gonna get much sleep here, and I walk in and you're very sleepy because you probably have not been sleeping all night. Because one of the reasons is that you need to keep moving and you're going to keep feeling these pains in your abdomen, cramps. Taking walks is really, really important. Number 1, it's going to help prevent blood clots. More importantly right now is the more pain that you have, the more walking is going to be necessary to get rid of that pain. Okay? The gas kind of lingers in your abdominal cavity. It can also affect one of the nerves called a phrenic nerve, and it pushes on the phrenic nerve, which is very common, and it starts to give people pains in their chest, their shoulders, the back of the neck. Yes.
My back.
Yes.
And right here on the chest.
Yes. So when you feel those types of pains, you need to change your position. Sometimes people just want to curl up into a ball, like in a fetal position when they're not feeling well, they have a lot of cramps. That's the opposite of what you want to do after having laparoscopic surgery. And this is going to be for patients who have had gallbladder surgeries laparoscopically. Anything abdominal that is done laparoscopically is done with that artificial CO2 gas. They insufflate the belly and then they pull out as much as they can before they close you up on the operating table, but they can't give you a negative pressure. So that gas has to get absorbed into the intestines and come out with flatulence. And the more activity that you do, the quicker your bowels wake up, and then they start absorbing that CO2 gas so you can pass it with flatulence.
Okay.
The other thing is pulling back on opioids or narcotics, and you're doing fantastic with that. We actually see that patients do not need the opioids on post-op day 1, meaning today. Okay. Yesterday, is a different story. You're waking up, they give you a tap block during the procedure, which actually gives you like a numbing effect around where the surgery was, but that wears off. Sometime last night probably that was wearing off, and your pain probably went from maybe a 5 to an 8 last night or even higher because that tap block is wearing off, okay? However, if we start giving patients lots of opioids to combat that pain, the opioids start putting everything back to sleep again. Opioids is something that patients who have constipation, you experience the constipation with the opioids because it's kind of slowing down the bowels. And that's not what we want to do right now. We want to waken up the bowels. We don't want to give it opioids. We want to just take Tylenol for pain so that we can get around throughout our day, and our bodies, our intestines and everything is waking up and start doing the job that we need it to do. So long term, years ago, we used to give patients a lot of opioids and they would be in pain for 5 days or so. Nowadays, we're really not giving the opioids so much, and patients are getting back to work and things like normal activities without heavy lifting, of course, but within a day or 2.
Okay, I got a question.
Yes.
Am I allowed to take Gas X?
You are. However, I'm going to tell you how Gas X works. So Gas X works on the intestines only, and what it does is it loosens up the bowels with like some water from your body, not a lot of water because it's very mild. However, it's not effective for the gas that's in your abdominal cavity. It's only effective on the gas that's in your intestines. So when you start feeling cramps, abdominal cramps, like you're used to long term, like when you have something to eat that doesn't agree with you, and you kind of feel the rumbling or you hear the rumbling, that's when the Gas X will be effective for you. In the beginning, the first day of surgery, usually, no gas is in the intestines. However, when I walked in this morning, you said that you finally passed some gas, which means that some gas is going into your intestines now. And so the Gas X might be effective. Yes, so you can use the Gas X.
Okay.
Okay. Sometimes warm liquids, and I don't know if this is just with some people or old wives' tale or what, but sometimes warm liquids kind of stimulate the bowels too. So number one,
tea, broth.
Yeah, yes,
Yeah.
Yep. Warm tea, warm broth, and we're going to talk about diets in a few minutes. But things like that might stimulate the bowels. But the most important thing that stimulates the bowels is pulling back on the opioids, which you already have done, fantastic. Mm-hmm. And the second thing is ambulation and moving and walking. And when we talk about walking, we don't mean walking from bed to bathroom or couch to bathroom and back to couch again. When you go
walking.
home, yes, walking for a good solid 10 minutes for about every 2 hours or so. So like if you walk the hallways here at the hospital, it's probably going to take you about 10 minutes if you did like kind of 2 loops around the hallways. Yeah. So those are really good. So you're going to have to become creative when you go home because you're not going to want to go outside during the winter when it's very cold out. So you're going to have to become creative in your home where you're walking kind of from room to room or walking around the kitchen table or the dining table and, spinning the other way and kind of getting creative. The other thing that we want you to do is we really want you to force yourself to bend your knees, which also helps kind of move things around in your abdomen. So stairs are fantastic. We want patients using stairs.
Okay. I stay at the house.
Perfect. Bending, stretching, reaching. We want you to do those activities. We don't want you to do activities that are strenuous. We also don't want you lifting anything more than 10 pounds over the next 2 weeks, because the incisions that Dr. Friedman created or made to get into your abdomen, those incisions are closed with sutures that are dissolvable way under all those layers of skin, but at the top it's covered with a glue, almost like a crazy glue. But they're weak areas. So if you strain and pick something up that's very heavy, or even more, not very heavy, but something like 10 or 15 pounds, you can get a hernia through one of those incisions. And then guess what? You'd be back to see us in a couple of months for a repair, and that's the last thing that you want.
Yeah, no.
Yeah. So, with the ambulation, you're going to continue taking a 10-minute walk every 2 hours until all that gas is gone. And you're going to know where the gas is gone because you're not going to have the pain any longer.
Yeah, because this pain is serious.
Yes, it is. Yes,
and
it is.
Back.
Yep.
From the chest to the stomach to the back.
Yes. And so when we think about it, it's not the surgical pain that you're feeling where she did the surgery.
No.
It's the gas that's pushing on your
organs.
organs.
You can feel it, actually. You can feel the gas.
Yeah, you can feel it moving.
Yes. Like rumbling.
Yes. Yes. So with the pain, every single day should be better than the last, okay? So when I talk about today's type of pain should be better than last night's pain, okay? Is it better? You think it's worse today than it was yesterday?
Same, about the same.
Okay.
Only maybe like, I want to say 5-10%.
Okay. Okay, we'll take that.
Yesterday it was a 10.
Yes.
Today is 8.
Right. And hopefully tomorrow is a 6.
Yeah.
That's the way that we should be going, okay?
Okay.
Remember that. I don't want you to today have a score of an 8 pain, and then tomorrow maybe have a score of an 8 pain still, and then the next day you have a pain of a 10. It shouldn't be going that way.
Yeah, it should
be going down, okay? And if you feel, because your body is going to tell you when something's not right, okay? If at any point that you feel something is not going right, you're going to pick up the phone, you're going to call the surgeon, okay? And if it's not your surgeon, Dr. Friedman calling you back, it's one of their associates, okay?
Right.
So somebody will be calling you back to figure out whether or not, A, do we want to see you again? B, are you experiencing things that are normal so that they can give you that advice and let you know? Or C, maybe they want to send you to the hospital. My point is, I do not want you to wait until it becomes an emergency where you think that now you have to go straight to the hospital without talking to the doctor. You should know in advance, okay?
Right.
As you're going along that, I need to talk to somebody, and call them. Do not hesitate. That's why they take call. Okay. All right. And the holidays are over, so I always say to people during the holidays, I don't care if it's Christmas Eve. I don't care if it's Christmas Day. If you don't feel well, I want you to call the surgeon.
Right.
Okay.
Right.
They're going to call them anyway when you get to the hospital. Even if you bypass the surgeon, you came to the hospital, they're going to be calling the surgeon anyway. Right. So call your surgeon first when you think that something's not right. Okay?
All right.
And like I said, the pain should be going down, and you should start getting a lot of flatulence. And the flatulence will probably continue for the next couple days. You'll keep passing that gas, So it's going to feel like a lot. You're going to be like, how much gas is actually in there?
Yeah, because sometimes, you see that?
No, I didn't see it.
I mean,
and I didn't hear it, but I could see your face,
and you were
like,
come out.
Yeah.
It's like stuck.
Yeah, exactly. And that's where the movement will come in and help you out. So the bending, the stretching, the walking, the movement is going to help kind of push the rest out. Now, it is often possible for patients to become constipated after surgery. We talked about the opioids causing constipation, but sometimes anesthesia causes constipation as well. And anesthesia, you were under general anesthesia yesterday. It does take some time for the anesthesia to wear out of your body, and everybody's a little bit different. So some people feel like they rid the anesthesia within 24 hours or so. Other people are kind of like, nah, I'm just not right yet. My head's not right. I feel really sleepy still, and sometimes the anesthesia can linger, for 2 or 3 days. So everybody's a little bit different with that. But like I said, everything's going to become a little bit easier. Okay. Now with the constipation, like I said, it is common after surgery. We don't want you taking over-the-counter things that cause more cramping in you, okay? So something like Seneca is on the harsher side, and what that does is when you take that medication, the medication pulls the liquids from your body into your bowels so that it can move the bowels through. We don't want so much of that because we're trying to make sure that you get enough hydration. So we definitely don't want to waste that hydration. But we want to use things like Miralax or Cold-Ace that are nice and mild, that do not give that severe effect of rushing fluid into your intestines, which actually causes more cramping.
Right.
So if you feel constipated, you can take Miralax. I always suggest to people not right off the bat taking it on a daily basis. Take it once, wait a day or two, see if you have a bowel movement. If you don't, go ahead and take it again. You probably will not have a bowel movement for about 3 or 4 days because your body has no waste products right now.
Yeah, I knew that.
You were on a clear liquid diet right before surgery. Yeah. You probably were flushed through, everything kind of flushed through. You might have a little bit of stool in there, but not much. Your body now has to start producing the waste products for you to have a stool, and that's not going to even begin until you start taking in some protein. Because right now you're on a clear liquid diet, so the clear liquids is only going to create urine. It's not going to create stool. But once you start taking in some protein, like a protein shake, your body is going to start thinking about that protein when you're ingesting it, and your body might say, you know what, I need all that protein, and your body's going to say, I'm going to absorb all that protein. I'm not going to make any waste because I really want the protein. But if you have much more protein than necessary, then your body's going to say, okay, I don't need that. I'm going to waste that out. Okay? So like I said, you probably won't have a bowel movement for 3 or 4 days. If you feel impacted, have you ever felt like impacted where you have to have a bowel movement, you're sitting on the toilet, you feel like it's right there, but it won't come out, sometimes, again, the Miralax would help try to get that through.
No, because I got a lot at home because I was already taking that because I was taking Mounjaro.
Okay. Yes, you probably were constipated on the Mounjaro. Yes, everybody gets constipated on those. Yeah. The other thing with the Mounjaro is I don't know if they stress enough when they're giving those medications about how much clear liquids, things that you can pour in a glass and see light shining through, how much clear liquids that you need to supplement with those medications. Like you should have been.
Tell you that.
Yeah, you should be drinking at least
I was drinking
over
a lot
64
of water.
ounces.
Yeah. I always drink a lot of water, so that wasn't my issue.
Yep.
Only thing is when you take that, you can't eat bad.
I know, you don't even want to.
Yeah. You can't eat no bad stuff like you. That joint rejected.
Yeah.
No.
Yeah.
It really do.
Yep.
It's like you gotta eat nothing but healthy.
Yeah. Well, hopefully you don't have to go back to something like that, which actually can lead to deficiencies, with protein because people are not able to get in a lot of food when you take those medications. And those medications are lifelong, whereas once you have the surgery, the surgery is supposed to be your tool for lifelong. And as long as you follow the guidelines and really stick to the guidelines, of course, everybody has urges. Everybody wants to cheat here and there long term. You would never cheat right after surgery doing anything that we tell you because you can cause harm to your body. But long term, you know, there are things that people do that they want to have because they have a sweet tooth or whatever else, you know. But going back into that constipation, go ahead and take Miralax if you really need it. If you feel impacted, you could do like a Fleets enema, okay? Any questions about that, constipation? Any questions about what you're experiencing with the gas and everything?
No, I just wanted to hurry up and get this gas out.
Yes, I don't blame you.
This is uncomfortable.
I know.
That's the only thing that's bothering me.
Yeah.
Other than that, I feel good.
Yeah.
I could walk good.
Excellent.
It's just this gas pain. This is nothing to play with.
Yes.
It's really hurt.
It's true.
It's like contractions.
Yes, it is. Yes, it is. All right. So I now want to talk to. I'm so sorry. Set that back up again.